So without further ado, I'd like to hand over to Roslyn for the opening presentation, and welcome all of you, and hope we have a pleasant and easy and smooth webinar and a great discussion a bit later. Thank you. Roslyn, the floor is yours.
All right, so just wait for the PowerPoint here to load, and I hope that there it is. Perfect, everyone can see that. So as Trevor mentioned, I'm Rosalind Graham, and I'm working with the Susanna Secretariat coordinating the Thematic Discussion Series, this new initiative from Susanna. And the first thematic discussion that we've had is on the topic of the Sanitation Ladder, next steps. And this will also be the theme today of the webinar. So I just want to quickly provide a bit of a summary of what happened during the discussion, and I'll just start off with a brief little overview of what actually took place, how it worked. Just go to my next slide there. All right, so we held the discussion on the Sanitation Ladder for 3 weeks on the Susanna Discussion Forum from February 9th to 27th. And it was led by 3 thematic leads, Patrick Bracken, and then, as Trevor introduced today, Elizabeth and Ricard, who are both here. And the discussion saw over 60 posts from 14 participants, so on the theme of the Sanitation Ladder. So I just want to provide a little background of why we had the discussion on the Sanitation Ladder at this point. So in 2011, with the paper, The Sanitation Ladder, A Need for a Revamp, a functional-based sanitation ladder was proposed. So as a development from the technology-focused sanitation ladder, which is currently used with the JMP, the Joint Monitoring Program, monitoring the Millennium Development Goals. And now, as we're in 2015, with the end of the Millennium Development Goals, we are moving towards the development of this process of developing the Sustainable Development Goals, which will be finalized in the fall of 2015 this year. So this function-based sanitation ladder is now seeing a need for revisions as we're entering this post-2015 period. And a quick kind of overview of what the difference is from the technology-focused sanitation ladder in a very quick way is the rungs of the ladder are focused on function as moving up the rungs of the ladder. And you see in the technology-focused, there is movement up the ladder, which is also focusing on technology-specific technologies. So moving to the next slide. So with this context of the development of the Sustainable Development Goals, we had the themes kind of around this revision process for the functional ladder. And the 3 themes are up there on the slide, but just to kind of give an overview of what actually ended up being the main points of the discussion for each of those weeks. In the first week, the discussion really surrounded the shift from the technology to a functional-based ladder, what were some of the pros and cons, and also of the general structure of the ladder. And we saw some introduction of alternative or complementary frameworks to the sanitation ladder, functional ladder. The second week, we saw discussion on the formulation of the Sustainable Development Goals, the targets and indicators, and how those indicators can fit into the functional ladder. For example, how would human rights or equity and equality fit into the functional sanitation ladder? The third week, we saw discussion surrounding actually orienting the ladder to practitioners, how to practically implement the functional sanitation ladder for delivery of sanitation systems. So today I'm just going to kind of go quickly through so we can get to the discussion. I'd like to bring through some of the key points that were raised during the online discussion of which areas still need some addressing in this revision process of the functional sanitation ladder, particularly in relation to the SDGs, so the Sustainable Development Goals. And on the slide here, you see the targets which have been proposed for the SDGs, which are related to sanitation, and in particular, the one in the middle, target 6.2, has the strongest relevance to sanitation. So the next few slides are the key points that were brought up in the discussion that are still open questions, and will hopefully also be part of the discussion today around where they fit into the functional sanitation ladder. The first point being, what is safe or adequate sanitation? So in the discussion, there was kind of a consensus that the MDGs were somewhere around the first rung. Unfortunately, it seems a little small, the writing in the presentation here, but that's at excreta containment. And so it was around that first rung in the MDGs what was considered improved sanitation. But keeping in mind that hand washing was not included in that definition. And with the proposed SDGs, we're seeing safely managed sanitation actually being part of those first four rungs of the ladder. And part of the further discussion was how will the rungs, the four rungs, as one kind of representing safe sanitation, how is that broken down? Does that reflect well what safe sanitation should be in four different rungs? And going to the next slide, so the next point being the scope of the functional sanitation ladder. So we saw a lot of discussion surrounding different aspects of the scope, whether the functional ladder addresses an individual sanitation project level, or where risk of contamination affects another individual sanitation project. Does the functional ladder address the settlement or the city level? In addition, and now unfortunately those images didn't work out, they're just boxes now, but that representing the household level, or will the functional sanitation ladder also represent the school, workplaces, health centers, rural versus urban, and low income versus developed? Can this all be included into one functional sanitation ladder? And then the next key point being also with the idea of having one functional sanitation ladder, how to incorporate concepts such as equity, equality, and human rights, and what are the important aspects of those concepts that can be included in the functional ladder without saying equity should be included, but what aspects need to be included so that those are represented in the functional sanitation ladder. And on that slide, there's a few of the questions and kind of lines of thinking that were brought up in that discussion. And then we additionally had some discussion on what are some of the limitations of the functional sanitation ladder. So part of that discussion looked at the linear aspect of a ladder in general, not just the functional ladder. Also looked at the difference between the functional and a technology-focused ladder, where technology for implementation purposes can be very clear-cut, and how to adapt the functional ladder that in implementation without having examples of technology, that this can be more straightforward to for implementers and practitioners. And so some of the approaches that were suggested to kind of fill some of these gaps, either complementary or ideas that were developed, were having an index approach, so having a multi-part indicator to move up the ladder for something to reduce the linear concept of a ladder, or to have case studies that would support practical implementation, to have references for the implementation level. And then with the service level approach level, we had actually a few examples from actual implementation of sanitation ladder adaptations, let's go to the next slide here. So you see the IRC actually adapted the functional sanitation ladder with a service level approach for practical implementation. And we had another example that was presented from SCAT where a service level approach was also used as a case to actually use for project implementation. And the service levels were facing the movement of you can say the ladders are up the levels of the service. So this was to basically, as mentioned here in the previous slide, to reflect the multiple dimensions which some felt was a gap in the functional sanitation ladder. So I just put on this slide kind of the key issues which were discussed that I've kind of mentioned here, and basically we've kind of seen actual implementation as of the functional sanitation ladder. So as we're moving towards implementation and revisions of the functional sanitation ladder, the discussion that we had and that we're having today on the webinar is really important to address these gaps towards making revisions to make sure the global goals that will be set with the SDGs are addressed, as well as implementation needs at a local level. So I will now pass it off to Richard and Elizabeth, but I would like to comment if anyone has any questions. I think we can save it until the discussion period, or you can put it in the chat, which you see is available to the right of this presentation here. So thank you.
Okay, thanks Rosalind for this nice presentation. Basically, then the next step is try to discuss a little bit further about the applicability of this ladder in terms of decision making, or if trying to discuss about how this kind of functional sanitation ladder may contribute to effective decision making. And to start with, I would like to highlight that any monitoring tool to be effective, specifically if we aim this tool to be applied to support local level decision making, has to produce timely information, has to make this information accessible to all stakeholders, and at the end of the day, it should promote the effective use of this information. So we should ask if this ladder will be able to produce this information, make it available, and then link this information to specific remedial actions. In my opinion, the functional ladder is clearly a step forward in the monitoring of the sanitation sector, and it improves the technology-based ladder in various ways. We've discussed and we all agreed that the functionality-based ladder provides more information to guide decision making. The technological ladder, for example, only informs about the availability of the sanitation infrastructure in a particular context, while the functionality ladder also relates to the quality and safety of the facility, gives information on accessibility issues, acceptability issues, privacy issues. So it produces much more information than the technology-based ladder. Having said this, the next stage is to ask if this information that the functional ladder produces, if it is directly linked to inform policy making. And I think, as I've said before, that any information has to be directly and easily linked to remedial actions aimed at improving sanitation standards. In other words, if functionality-based outcomes are not easily linked to planning and decision making, then this information may be unused, and at the end of the day, it hinders the utility of the tool. For me, then, it raises a crucial question. If, for example, one sanitation facility is marked in the functional ladder as level 1, let's say excreta containment, then what a decision maker needs to do, which actions do a decision maker needs to carry out in order to upgrade the sanitation service. If, for example, a household is categorized as level 2, I mean, this means safe access. Again, what actions do decision makers or the household by themselves need to do to improve the ladder? I mean, I think that this kind of information and to link this information to remedial actions to decision making is crucial for a monitoring tool to be effective. Then, I would say that the links between current functions of the functional ladder and decision making are not now very clear, are not straightforward. And in my opinion, this is a kind of weakness that we should tackle when we review the tool. Another aspect that I would like to raise is when we move to the adaptability of the tool to the Sustainable Development Goals, and this has been already raised by Rosalind. One issue is that requires further attention is to link or to identify how well the human right criteria are integrated in the functions defined by the ladder. It's clear that some of them, such as availability, quality, accessibility, are already there and are clearly included. When we measure, for example, 24-hour access, or when we measure if there are flies or no, or if there are other vectors, or if there is fecal material, or if the facility is adapted to the needs of the users, I mean, we are already measuring aspects as availability, quality, safety, and accessibility. In a way, I would say that acceptability issues are also included, are also taken into consideration, since in the rank number 2, when we say that the facility offers privacy, in a way we are somehow measuring acceptability issues. One issue that is not there is affordability. In my opinion, I think that a monitoring tool that integrates the human rights criteria should in somehow measure or assess if the sanitation is available at a price that is affordable for all. And I think that it's an important issue. Another key issue, and it has been already discussed during the forums and it has been raised by Rosalind before, is the issue of equity. If we need this tool to measure equity or to help producers information about the equity outcomes that could be at the end of the day considered by decision makers. Then, having said this, I would say that we could somehow link the ladder with the proposed target, specifically the target 6.2 and 6.3. But again, I mean, the links between the ladder and these two targets are not clear. And I think that if we want to review this ladder to inform the Sustainable Development Goals, the functions should be presented in a different way in order to provide clearer links. There's another issue, and it's more related to the last point of the discussion, which is related to if we have adequate indicators for measuring all the different functions. I would say that for the lowest ranks, I think that it's somehow easy to identify good or adequate indicators. But for the top ranks of the functional ladder, those related to nutrient reuse, eutrophication risk, etc., I would not say that we have good indicators to measure these ranks of the ladder. And again, I mean, it's useless if we define a kind of academic ladder that those indicators cannot be easily assessed in the field. And just to finish this intervention, I would like to highlight one, in my opinion, important issues in relation to the scope of the ladder. And I think it was already raised in the first questions of the discussion. I mean, what do we want to monitor with this ladder? Are we aimed to monitor developed countries, low-income countries, rural contexts, urban contexts? And in this regard, I would say that, I mean, in my opinion, this ladder should be specifically aimed at measuring the sanitation status in those contexts where access to sanitation is the lowest. And this is why maybe one recommendation is to expand the two lowest ranks of the current ladder in order to better discriminate among different service levels. Another option, for example, could be to include in the ladder those households that have no access to sanitation. I mean, open defecation is not included in the ladder, and I think it's another important aspect that we need to include. Because again, maybe I think that it's 15% total population in the world do not have access to facility at all. And the ladder should reflect on these people. And I think that at this stage, this is all the issues that I wanted to raise, but clearly we can further discuss about them in the discussion. And hopefully, I mean, I'm sure that Elizabeth will have more inputs to these particular issues.
Thank you very much, Ricard, for that input on the question. I'd like to, before we open up the floor for discussion, remind you please to raise your hands if you want to verbally ask a question. Otherwise, please continue to type them into the chat masks. And then I'd also like to give Elizabeth yet now an opportunity to add to what Ricard has already opened up with. Thank you, Elizabeth.
Thank you, Trevor. Can you hear me well? Okay, yes. I will keep myself short. I agree with basically everything that Ricard is saying, but I think it's also important to, my feeling a little bit after these 3 weeks of discussion is that we're trying to fit too much into a ladder, and we have to, and that is going to be counterproductive, I think. In my opinion, the ladder is a monitoring tool and nothing more. So it's important to differentiate between what you actually can use the monitoring tool for and all of these important issues that rather fit into the planning stage or the implementation stage or the kind of assessment stage afterwards. And I do agree, and I think a lot of these things, I don't agree with Ricard on the affordability, because, you know, if it's a monitoring tool and you're assessing whether it works or it doesn't work according to whatever level you have decided that you're aiming for, like the 4th rung, if you're going for the SDGs, for example, how you reach that point doesn't really matter. I mean, the important thing is if it works or if it doesn't work. The money comes in the planning stage because you want your money to last the longest, or it comes in afterwards in a kind of an assessment stage to see, okay, so we didn't, as Ricard said, so we didn't reach higher than this on this run, and we had aimed for, you know, maybe we reached 2 and we aimed for 4. And so why didn't we reach this? And this is where I think equity issues comes in, affordability, and what did go wrong. I don't think, I mean, what's the point of measuring that if it's working? I don't know if I make myself clear here. I think it's really important to differentiate between the actual kind of small monitoring tool and then these kind of remediative actions that Ricard was calling for, because I think we need that as well. But that's not the monitoring tool. That's some kind of add-on that we should work on as well. But I think it's important to keep the ladder a ladder and a monitoring tool, and then we have add-ons to address.
Forum users, how the proposed sanitation ladder will further the SDGs on sanitation. Maybe just a commentary to that from yourself, Ricard, could be useful to help them out.
Yeah, well, basically, I mean, my feeling is that the target 6.2, I mean, which deals with the issue of adequate sanitation, access, and all. I mean, the information. I mean, if you collect the information to assess the lowest ranks of the ladder, I mean, of the functional ladder, which relates again to the safety issues, accessibility issues, I mean, privacy issues, and hand washing facility. I mean, all these issues provides the information you need to assess the target 6.2, and the information is there. However, what I was trying to say before is that the information is not directly linked to the target. So one issue to improve the sanitation ladder would be to reorganize the information and to produce those functions more related, in a way that are more related to the specific targets or the targets that are now phrased on adequate sanitation. So my feeling is that if you measure the functional ladder, you will have all the information to assess at least target 6.2. In relation to target 6.3, is more related to the lowest right, to the top ranks of the ladder. I mean, I think that is the one related to water management. I mean, again, if you've got this information, I think that you've got part of the information to assess target 6.3. Not sure if Elizabeth could add on this, but my feeling is that the information is there. How you present, how do you disseminate this information, how you organize this information will produce the relevant outcomes to assess target 6.2 and target 6.3.
Thank you, Richard. I'd like to ask Elizabeth if you maybe want to add to that. And then in addition, if you could also perhaps tackle John Collett's question, where he asks if accessibility is included, does this consider convenient location of the toilet as a secondary part to your response? Thank you, Elizabeth.
Sure. Yeah, I would agree with Ricard that I think the sanitation, the functional ladder, with a reorganization can actually be helpful to assess 6.2 and 6.3, but I think also higher up, because the other three suggested targets are going into integrated water management, and you can't achieve that unless you have your wastewater management under control. So I think we can actually, the thinking in the ladder actually fits also to the higher goals of target 6 of the SDGs. And then the question was accessibility. Yeah, I would say that rung 2, where we say that to achieve rung 2, it has to be accessible for everybody on 24/7 basis. That means that if you're going to have 24/7 access, that means it must be conveniently located to your house. That would be my interpretation. Ricard, do you want to say something on that?
Yeah, just to add on this, I mean, I think that I would differentiate between 24-hour access and how easy or how secure is this access to the facility. I mean, for example, I can have my sanitation facility may be a public one, and it's 100 meters located from my household, and it's open 24 hours, and I can access it 24 hours. But it does not necessarily mean that the access to this facility is safe, is secure for me, and for example, it's not the same if I have it in a public space or if I have it in my house. So, but the feeling is that, I mean, accessibility issues, which is the important issue, is, in my opinion, included in the rank number 2, as Elizabeth says, and maybe we could discuss about which indicator should we include in this rank number 2 to completely define what we meant by accessibility. And I agree with John that, I mean, having the toilet facility in the household is an important aspect in terms of accessibility. But again, I mean, I think it's an issue of how we define the indicators included in each of the functions.
Thank you.
So can I just add that it actually says safe as well. So it depends on what you put into safe. So
yeah, exactly. You're right. Yeah.
It's there. It is there already.
We have another question here from Sashka, which says, are there plans to develop a functional sanitation ladder and advocate this in the post-2015 agenda negotiations? Has there been input from the JMP team? I don't know who wants to tackle that.
I think that, Elizabeth, you are well positioned.
Please, Elizabeth.
Without sounding too bitter, but we have tried to participate in JMP webinars and sharing this ladder, and I've emailed, because there is a team at the University of North Carolina who has the task of trying to find a way how to monitor safely managed sanitation. So I have also communicated with them, but not much of a response at all, to be honest, which is a bit sad. But then maybe Trevor wants to say something about the future.
Well, I mean, from our perspective, from the Susanna Secretariat perspective, we obviously are very happy that this discussion has taken place, and are hoping to support Elizabeth and Ricard and Patrick and other authors to continue working on the functional sanitation ladder. And we will have discussions hopefully after April, I think it was, and see where that leads. Whether that is timely, the timing is right to have it fed into the JMP or the other post 2015 development negotiations. That I'm not aware of. I'm not sure. I have to just take it as it comes. And then with that, perhaps I'll just go on to the next question here from Rural Blessgraf. The question is: the End Water Poverty Network, including WaterAid, GTO, and Simavi, is currently discussing how to advocate for better indicators regarding targets 6.2 and 6.3, but how to include sanitation, fecal sludge management, into target 6.3 is still a question for us. That's a question or a statement. So maybe if Ricard or Elizabeth, if you have any thoughts to add to that, that would be great.
Not sure. From my side, I would say that I do not have a clear answer to this question. Basically, again, I mean, from as far as I know, I mean, the process defining indicators to be included in the SDGs started, I mean, 4 years ago. I mean, at least the task forces organized and led by the JMP. So at this stage, I think it's not easy to provide inputs for the JMP or for the Open Working Group on SDGs in terms of how to better define the targets. My opinion is that, I mean, if there's a consistent approach to better define sanitation, I mean, I'm sure that we could report this proposal to the people from the AGMP. I mean, I'm not, I mean, as Elizabeth already says, I mean, it's not easy now to include, I mean, to be realistic, I do not feel that we are in a position now to influence this process, but any process or any tool that improves monitoring of sanitation at the local level will help. I mean, even if it's not directly linked to the SDGs. I mean, any NGO or any local authority that aims to use this tool, if the tool is consistent, I mean, it makes sense for the sake of having a good tool to monitor sanitation. And I think this is the aim that we need to achieve, trying to review this sanitation functional ladder.
Thank you, Ricard.
Yeah. So if the question is how to advocate, if that's the question, how to advocate for better indicators, I think you should email the Open Working Group with your ideas for good indicators that are practically functional in your setting. I mean, that's the only thing we can do. The targets are set. They're not going to change. The indicators, there might be an opening if they ever is listening. But the only thing you can do is to try and include it and think about it. But I think, for example, for fecal sludge management, the most reasonable would be to base treatment targets for that on the existing WHO guidelines, for example. And then depending on if it's a big system or a small system. But I think that has to come in somehow in big management.
Thank you, Elizabeth. We have, I'm just keeping an eye on the time, so we're into the last sort of 5-6 minutes of the webinar. And we have a further question here that Anne-Catherine has put in on behalf of Magul. And it says, since there is wide difference between the developed and poor developing countries in terms of technology and economy, how about having 2 sanitation ladders, one for the developed countries and another for poor developing countries? Remember, any improvement in the rung to the next level will entail substantial costs, which developed countries won't mind, but would be a great constraint in poor developing countries. Who would like to have a response to that? Richard or Elizabeth? Richard, please.
Yeah, as I've said before, in my opinion, these kind of monitoring tools, are very welcome in those settings where resources are not. I feel that these kind of tools make sense when we apply in low-income countries, in those settings where capacities are not high and where there is a huge sanitation challenge. This is why, instead of developing two different ladders, my point would be to develop one ladder focused on those specific people with poor access to sanitation. And this is why, I think that the lowest ranks of the current ladder are not adequate to discriminate between the different service levels that are already there. I think that, for example, we need to include people that do not have access to sanitation. Those people that defecate in the open, those people that have access to improved technologies, but the technologies that are not safe, that are not adequate, that are not accessible. I think that we need to expand the lowest ranks of the current ladder in order to better discriminate the current context in those settings where access to sanitation is very basic. And my feeling is that I'm not really sure about the utility of this kind of tools in, for example, a developed country. I would question this.
Elizabeth, would you like to add?
Yeah, I don't agree. Not totally. I understand the need that it could be good to expand the lower rungs, and that's a little bit what the SDG has already an expanded kind of ladder included in their thinking, where they go from open defecation up to safely managed. So the question is just, how do we measure the safely managed? So yes, we could do that, but I certainly think we should have one ladder, and I certainly believe that since, as I said before, the full target 6 of the SDGs is going up all the way to integrated water resource management, it would be cool to actually have a ladder that goes all the way up there. It has a pedagogical importance, I think, to stay within the same tool can actually be used to monitor the full target 6. That would be brilliant, I think. And without question, of course, sanitation, if you want to go from one rung to the other, costs enormous amounts of money, and that's just how it is. And it's also clear then, if you have it in one ladder, maybe you could, in some supporting documents, one could discuss what would it cost to move from this step to this step, and then like an advocacy exercise or something. But I don't think that's the reason to split it up to 2 ladders and to only measure on the lower rung, because frankly speaking, there are very few countries in the world that are up there protecting the environment, are doing integrated resource management perfectly nicely. So I don't agree on splitting, and I don't agree on only measuring in the lower rung. But I do agree on making it more refined on the lower rung.
Thank you very much, Elizabeth. I think we can all see that there's still a need for discussion, and that this is a valid tool and a valid mechanism to continue working on. As we're basically almost at the end of our time, I think what I'd like to do is just fit in. There's one more question from Sophia Pan. I'd like to ask her to maybe just get a very short, sort of one sentence response from Richard and Elizabeth, and then I'll say 1 or 2 words in what the next steps from our side are and what you can follow in the near future, and then I think we'll wrap it up with a couple minutes over the time that we advertised. So the question from Sophia Pan is, who do you think this monitoring tool would best serve? If it is not adopted for the JMP, how frequently would assessments be performed? And maybe if there's just a simple or short answer to that from Richard and Elizabeth, that would be great.
Short answer. In my opinion, I think that the JMP focuses on international level monitoring. I mean, they monitor countries, they monitor the national level, and these two make sense at the local level. I mean, it's useful if it provides information for local decision makers, and of course it's going to be very useful if this information is directly linked to inform the nation at the national level for the JMP. But I would distinguish between the processes at the national level and at the local level. And how frequently would assessments be performed? I think regular assessments, I would say annual assessments. This is why, and this is very important to link which kind of information indicators are we going to use, because if these indicators cannot be regularly updated on an annual basis, I mean, then the ladder and the indicators are useless, because I mean, decision makers will have the information once and then they will not be able to upgrade this information.
Thank you, Rick. Elizabeth?
I would totally see this tool as being something that would feed into the JMP data and the SDG data, of course. So whatever we propose has to have that quality. And however often measurements are done for JMP or SDG follow-up, this is where different projects on local level could also use this approach, I think. So I think it's locally implementable, but you know, it should feed into the national and international processes. So yeah, it should be at the same interval as anything else is measured and monitored for the sanitation SDGs and MDGs. The sanitation SDGs.
Okay. Thank you very much, Elizabeth. Thank you very much for everyone who has attended the webinar. I hope you have enjoyed this vibrant discussion that we've had. Any questions that have come in that are unanswered, or any questions that come in the next sort of 10 minutes, we will endeavor to get responses from Ricard and Elizabeth to them. What Rosalind will do is she will put together a short summary of this webinar, which will make available to all people who registered for the webinar. And in addition to that, this webinar has been recorded, so we can always have a listen to it and watch it again sometime in the future. From our side, next steps would be the discussion has not come to an end, of course. There is still work to be done, and more work will be done on the functional sanitation ladder. The forum discussions will continue there, and we will convene the authors hopefully in the near future. We're looking at sort of beginning of May to discuss how we can tangibly continue with work on this functional sanitation ladder and further develop it and feed it into the sector's discussion. With that, I'd say if you have any questions regarding future webinars or regarding the thematic discussion, please by all means email the CESANA Secretariat or place them on the forum, and we'll happily respond to all folks that ask questions. And yeah, without further ado, I'd like to thank everyone and wish you still a good day. Thank you very much.